All right, this is Obaid on behalf of American Income Life, and in this video, we'll be filling in our kidney questionnaire. So this is for kidney disease. Okay. And for those of you who don't know what a kidney disease is, a kidney disease could be any disease that has to do with damage to kidneys or a disease relevant to a kidney. Okay. So nephritis would be one example. Another example would be your kidney stone disease, your chronic kidney disease, so on and so forth. Okay. So statistically, rates for both chronic kidney disease and mortality have gone up, relevant to diabetes and aging global population. Okay. The World Health Organization has reported that kidney disease have gone up from the world's 19th leading cause of death to the ninth, with the number of deaths increasing by 95% between 2000 and 2021. In the US, okay, kidney disease have gone up with numbers 1 in 8 in 2007 to 1 in 7 in 2021. Okay. So you can see over here on the right hand side, this is an example of a kidney disease. You've got a kidney and you have a cyst forming around the kidney. Okay. Okay. Some statistics. 10% of the global population is affected by chronic kidney disease, and millions die each year because they don't have access to affordable treatment. Over 2 million people receive treatment with dialysis or a kidney transplant to stay alive, and this number may only be 10% of the overall population. Okay. Of the 2 million people who receive treatment for kidney failure, majority are treated in 5 countries: US, Japan, Germany, Brazil, and Italy. Okay. More than 90% of patients who receive treatment for kidney failure, okay, they're in countries with access to universal health care. It is estimated that number of cases of kidney failure will go up in developing countries. Okay, some CT scans of kidney disease. And this is your kidney stone disease. You can see over here, this is your kidney stone. Okay. Okay, so starting with glomerulonephritis. Okay, so this is basically used for several kidney disease. Okay, and this may lead to inflammation, glomeruli, or small blood vessels in the kidneys. Okay, secondary causes, they include but not limited to bacterial, viral, or parasitic pathogens, drugs, systemic disorders, or diabetes. Okay, polycystic kidney disease, and this is a genetic disorder where your renal tubules, they become structurally abnormal, leading to growth of multiple cysts around the kidney. So if you look at the photo on the right-hand side, you have 2 kidneys with cysts forming all around the kidneys. Okay, all along the kidneys. Okay, so diagnosis include but not limited to pain or red urine, positive family history, palpation of enlarged kidneys on physical exam, so on and so forth. Okay. Next, you have acute kidney injury. Okay, so acute kidney injury was previously called acute renal failure. Okay, this is basically a sudden decrease in kidney function that develops within 7 days or so. Okay. Okay, this may also lead to an increase in creatinine, okay, or a decrease in urine. Okay. Causes include but not limited to sepsis, which has to do with infection, dehydration, excessive blood loss, heart failure, so on and so forth. Okay. Okay, diagnostic. This covers urine microscopy and urine electrolytes. Okay, Alport syndrome. Okay, this is a genetic disorder which impacts between 5,000 and 10,000 kids. Okay, and one of the ways you can diagnose this syndrome is through a urine test. Okay, as you can see over here, you have blood in the urine, which is an indicator of this disease. Okay, chronic kidney disease. This is a type of long-term kidney disease, very common. Okay, gradual loss of kidney function, which happens over a period of months or years. Okay, can lead to kidney failure, requiring kidney dialysis or kidney transplantation. Okay, causes include but not limited to diabetes, high blood pressure, glomerulonephritis, and polycystic kidney disease. Okay, risk factors, family history of chronic kidney disease, so on and so forth. Okay, diagnostics, blood test, urine test, so on and so forth. Okay, kidney cancer, also called renal cancer. Okay, symptoms include but not limited to blood in the urine, a lump in the abdomen, back pain, so on and so forth. Okay, risk factors include smoking, certain pain medications, previous bladder cancer, being overweight, high blood pressure, certain chemicals, and a family history. Okay, treatment includes surgery, radiation therapy, chemotherapy, so on and so forth. Okay, kidney cancer, statistically speaking, they impact around 403,300 people and led to 175,000 deaths globally in 2018. Okay, cystinosis. Okay, this is a disease that is relevant to abnormal accumulation of cysteine. Okay, it leads to abnormal amounts of carbohydrates and amino acids in the urine, excessive urination, and low blood levels of potassium and phosphates. Okay, interstitial nephritis. Okay, this is also called tubulointerstitial nephritis, which has to do with inflammation of the kidney, known as renal interstitium. Okay, so fever is the most common sign and symptom, occurring in 30 to 50% of the patients. Other general symptoms include, but not limited to, nausea, vomiting, fatigue, lack of appetite, and weight loss. Okay, lupus nephritis. This has to do with inflammation of kidneys caused by systemic lupus. Okay. Diagnostics include, but not limited to, blood test, X-rays, ultrasound, kidney biopsy. Okay, signs and symptoms: fever, high blood pressure, joint pain, muscle pain, rash, foamy urine, so on and so forth. Okay, Fabry disease. It's a rare genetic disease which impacts kidneys, heart, brain, and skin. Okay, one of these symptoms, okay, foam in urine. Okay, kidney stone disease. Okay, this is where a solid piece of material develops in the urinary tract. Okay. Risk factors include high urine calcium levels, obesity, certain foods, some medications, calcium supplements, and not drinking enough fluids. Okay. Diagnosis may be done via urine testing and medical imaging. Okay, so let's go ahead and fill in this questionnaire, starting with the application number. All right, so the application number may be an application number, okay, for your base policy, or it could be a separate policy for which you're adding your kidney questionnaire as a supplemental coverage, okay, or as a rider, okay. So let's say your application number is 1234567 8. Okay, and you may verify this application number with your life agent. Okay, so the first question, or before we move ahead to the first question, the name, this would be the name of the life insured. Okay, and moving on to the first question. So have you ever been diagnosed with any one of these diseases? Okay, so chronic kidney infection, nephritis, glomerulonephritis, or an abnormal renal function test. Okay, so just over here, you'll put an X. All right, date diagnosed, let's say 24th October 2023. Okay. All right. Now for diagnostics, you may want to use a blood test, urine test, X-ray, or a CT scan as recommended by a physician. Okay, so for details, the patient may rely on your electronic health record, okay, your EHR, and the doctors may check their medical records on the system, okay, and the insurance company may rely on MIB as well as inspection reports, okay. So for details, we'll type in urine test indicated a chronic kidney infection, okay. Do you currently take any medications for your kidneys? Okay, so medications, okay, whatever the name of the medication might be over here. So XYZ medication. Okay, your dosage has to do with how many tablets or how much in volume of that medication you take. So let's say 2 tablets. And your frequency, let's say this frequency is 2 tablets a day. Okay, or once a day. All right. Have you ever had surgery or been hospitalized because of your kidneys? So here you will say yes. And the date would be a month after diagnosis. So let's say 24th November, 2023. All right. Okay. So again, the patient may rely on his or her EHR, and the doctors may check medical records, while the insurance company may rely on MIB and inspection reports for this information. Okay. So when it comes to detail, this would be details of the surgery or hospitalization. For example, you had a surgery for removal of a kidney stone and you were hospitalized for 2 weeks. Okay, so hospitalized, let's say hospitalized for the treatment of chronic kidney disease for 2 weeks. Okay, have you ever had tests performed on your kidneys? Okay, so this test has to do with the health of your kidneys. Okay, so when it comes to the health of your kidneys, you can do a blood test. So that would be a serum creatinine, okay, EGFR or EGFR, okay, your blood urea nitrogen or BUN. Okay, you may also do a urine test, okay, which covers 24-hour urine collection. An imaging test, which covers ultrasound, CT scan, MRI, okay, and other tests, which include but not limited to kidney biopsy, MGFR, so on and so forth. Okay, again, for this information, your patient may check your EHR, electronic health record, and the doctors may check their medical records. Okay, so date, let's say 25/10, a day after diagnosis, chronic kidney infection. So let's say 25/10/2023. Okay, and details. Okay, again, you can say, okay, did a urine test. All right, in this case, you would say, because you did a urine test a day earlier, okay, I used, I gave a blood test, gave blood samples for blood test. Okay, relevant to the health of the kidney and other possible disease. Okay. Okay, so in some cases, one disease may lead to another disease. Okay, so that's another reason why you might want to get your kidney test done. Okay, so name, address, and phone number of physician with current records. So let's say this is YZZ, YZ, name of the physician, address 123, Hospital Drive, Brampton, Ontario, L4L, 4V, whatever the last digit is. Okay, so for the name and address, as well as the postal code, you might want to check your Canada postal code lookup tool, 411.ca or Google Maps to verify this information. Okay, have you ever had or been told you needed dialysis? Okay, so when it comes to dialysis, you have procedures like hemodialysis for your kidneys. So let's say you did hemodialysis a week after you were diagnosed with chronic kidney disease. Okay, so 24, you can say, let's say 30th, just around the week, less than a week. Okay, so 30th October 2023. Okay, so details. Okay, again, we're talking about hemodialysis. This is a machine, one of the machines that's used for hemodialysis. This is the procedure. Okay, you've got different types of dialysis methods. You've got hemodialysis. Okay, you have hemofiltration. Okay, so on and so forth. Okay, so went through a hemodialysis procedure a week after diagnosis. Okay, have you ever been diagnosed with diabetes, heart disease, or high blood pressure? Okay, so before we move ahead to diabetes, let's talk about uh, dialysis as well as kidney transplantation. Okay. So an estimated 35.5 million Americans, they have kidney disease. About 808,000 Americans, they're living with kidney failure. More than 557,000 Americans, they're on dialysis. Okay. Kidney transplants, more than 250,000 Americans are living with a kidney transplant. And there are more than 93,000 Americans on a kidney transplant waiting list. Okay. All right. So let's go ahead and choose diabetes. So again, diabetes has to do with blood sugar. Okay. Your heart disease, any one of the cardiovascular disease, which leads to a heart attack or anything of that sort. Okay. And your blood pressure. So high blood pressure. Okay. And you may check your blood pressure using your blood pressure monitor, which shows your systolic, diastolic, so on and so forth. Okay. So here you will say diabetes. Have you ever had a kidney transplant? So you will say yes, because of the chronic kidney infection. Date of the surgery, this would be a month later after diagnosis or diagnostic. Okay, so a month after diagnosis. So let's say, okay, 24/11/2023, the same day when you had your surgery or where you were hospitalized. Okay, so, okay, if the surgery within the past year, do not proceed. Okay. So if the surgery was within 12 months, don't mention it. Okay. So name, address, and phone number of the hospital where confined. So let's say 123. Okay. Excuse me. XYZ Civic Hospital, the name. Okay, and 123 Hospital Drive. Okay, Brampton, Ontario. And the postal code will be L4L4V, whatever the last digit is. Have you ever had any episodes of rejection? Okay, so this would be a rejection relevant to kidney transplantation. Okay, so when it comes to kidney transplantation, okay, you may check your EHR and the doctors may check medical records. Okay, so symptoms of kidney rejection include but not limited to flu, fever of 101 degrees Fahrenheit or higher, a urination, high blood pressure, okay, weight gain, swelling in your ankle, so on and so forth. Okay, so in this case, we'll say no. Okay, was the donor kidney from a living donor? Okay, yes or no? Okay, so that's a yes. Okay, so again, living donor has to do with a donor who was alive when he donated the kidney. Okay, is a physician who checks your kidneys a nephrologist. Okay, so nephrology has to do with pediatric and internal medicine that concerns the study of kidneys. And a nephrologist is the person who went through additional training and became certified in nephrology. Okay, so here you will say yes. Signature of the applicant. So let's say this is the life insured. Okay, want to make sure you sign in the same ink as the ink that you filled in your application with. Okay, okay, as well as the date. Okay, so again, let's say this is 24/11/2025. Okay, signature of the agent. Okay, say the agent proofread the document or the form on the same day, 24/11/2025. All right, so this is basically how you fill in your kidney questionnaire. Okay, on behalf of American Income Life, this is Obey. Have yourself a great day.